Okay, which of the following is the most likely diagnosis? Cool. Yeah, one of these. Torsion, endometrioma, theca, teratoma. All right. 28-year-old woman, G1 at 30 weeks gestation, presents obstetrician with abdominal discomfort, bloating. She has infertility, underwent ovulation induction therapy using HCG prior to becoming pregnant. Physical examination, it was the distended abdomen, bilateral adnexal masses. Ultrasound confirms with the bilateral ovarian cyst, which is the following. Yeah, all these I kind of get mixed. So I think kind of getting the characteristics. I don't think it's ovarian torsion. Because usually you get that from exercise or sex or something like that. I don't think it's endometrioma because this is definitely an ovary kind of cancer neoplasia. I believe. Let me see. It's Theca. That's I think you used to have hirsutism and virilation, so I'm not leaning towards that. I think serous cystadenoma is probably the most common service epithelial thing. So probably that because the teratoma, I assume there'd be hair and all that. The only other thing to confirm what I just said would be the beta HCG to get pregnant. I feel like serous is still the safer option. Pica
Okay.
gluten.
So let's see, kind of patient's history of infertility, ovulation induction using ACG, and the presence of bilateral ovarian cysts are consistent in thecaleucin cysts. These cysts are typical functional ovarian cysts that can develop in response to high HEG, as seen as patient with ovulation induction therapy. Thecaleucin cysts are typically bilateral and can cause abdominal discomfort and bloating. So this makes sense. I think you're thinking about something else. You're thinking about Sertoli leydig.
Yeah. There the virilation. Yeah, I can't remember theca gluten where that. It's
Yeah,
I knew beta HCG is high in one of those cancer things, but
Yeah, so this is not a cancer. This is a regular cyst, practically from overstimulation of your ovary. So it just causes like a big cyst. What
yeah,
you're thinking about is like a tumor, Sertoli tumor, which secretes testosterone and things like that. So that's why you get virilization.
okay,
Yeah.
okay.
So ovarian torsion, like you said, it's not really bilateral. What are the odds of you having a bilateral ovarian torsion, which is, you must be the most unlucky female in the world, right? Unlikely. And it's going to be acute, horrible abdominal pain, right? Endometrioma, right? Ovarian cyst that forms when endometrial tissue forms outside of the uterus and involves the ovaries, right? Usually unilateral, associated with endometriosis. So unlikely here. Mature cystic teratoma, right? Or a dermoid cyst, usually benign, but it has all three layers, right? And it can have hair and teeth and all sorts of stuff, right? And usually not associated with HCG levels. Serious cystadenoma, abdominal discomfort and bloating, however, right? It's usually unilateral for the most part, but infertility, HEG, things like that, that's not going to be supportive of serious cystadenoma. Questions
Uh,
about this?
let me see. My screen went off. See what pops up. I while it's loading, I think the biggest thing is adnexal mass. Like, even though it involves the ovary, usually it's not necessarily mean neoplasia, I guess. It
Yeah,
could be
so neoplasia, what is the definition of neoplasia?
like a cancer, like malignant, right? Something malignant or change.
So abnormal and uncontrolled growth of cells resulting in tumor, but tumors can be either benign or malignant, right? So a neoplasm, the reason why I wanted to tell you kind of what it is I want you to use the correct terminology, right? Neoplasia or neoplasm just means benign or malignant mass. Does it
Benign.
make sense what I'm saying? So when you say something's malignant or cancerous, then that makes sense, right? But if you say neoplasm, that can mean benign or malignant.
Okay.
Okay. So that it's just kind of a terminology thing. And so a lot of physicians will want to, tell you, hey, you want to use correct terminology when you're dealing with cancer or benign things, right?
Yeah.
And tumor, right? There, tumor doesn't necessarily mean it's malignant. It can also mean it's benign too. So a tumor is just a mass. You get what I'm saying? Also, so just things to think about.